Hey, everybody, welcome to Ask Dr. Testosterone, starring Dr. George N. Tuliatos, and brought to you by his book, The Bible of Bodybuilding, available on Amazon.com. Everything you need to know about training, nutrition, supplementation, and of course, PEDs. And while you're on Amazon looking for awesome books, this is awesome as well. Real Bodybuilding by Ron Harris. Wow. And now, all the way from Athens, Greece, please welcome the good doctor, George Tuliatos. Hey, doctor.
Hello, Ron. Have a good week.
Yeah, we had a contest in Europe yesterday.
Yes, and there was a new competitor there. I mean, a new qualifier for the Olympia, Eastern Bloc, Ukrainian. I mean, they are really hardcore and they have tradition in bodybuilding. The Ukrainians and the Eastern Bloc, Russians. Yeah. Huge guy. It's going to be interesting. We also need Chryso to establish, and we have the Italian Mario.
We got Andrea Presti, Andrea Muzzi.
Andrea Presti, yeah.
So two Andreas.
Yeah, it's been a while since we had that many Europeans,
Yeah. Also, Theo Leguerre from France. He was number one in the points, so he's going to Olympia too.
Oh, really? So it's American, huh? Okay.
Yeah, it's going to be a lot of good Europeans this year competing in America. I wish this guy had Vlad Sukhorochko from Ukraine, but he trains at Oxygen Gym in Kuwait. He's part of the Camel crew. Mm-hmm. Yeah. So he looked phenomenal. Congrats to him. All right. Ready for some questions?
Yeah. Sure.
First one is from an over 50 gentleman. I always like to get to those guys, my age range. I have a question. I'm 51 and have had a testosterone test recently, and I have an overall test score of 614. I also found out his free test was 69. Am I too high for a TRT? My doctor said TRT comes with a much higher risk of prostate cancer. Is that true?
No, this is not true. And the association, the link, the straight association between testosterone and prostate cancer has been debunked already, either from urologist Morgetale or other doctors. BPH is another story. We said that. Prostate cancer, besides, happens to men with low testosterone as well, because estrogens out of low testosterone can proliferate the cells of the prostatic gland. Speaking about now the levels, what is important is the free testosterone. And does this guy mention the range? Because I'm not sure, 69, what does it go for in the range of the free testosterone?
So actually I did look into that because I was curious, because I know mine was in range, so I didn't worry about. Okay, so free testosterone for a male. What are we looking at? Age and male. Okay, so that's female,
it's
male.
Up to the lab also sometimes.
Okay, I found it. So male free testosterone, 41 to 51 years, anywhere from 0.3 to 21 is in the acceptable range. So he's well over that. He's out
of the question. Nevertheless, he can take some Proviron, DHEA to feel better, to boost his free testosterone, but not exogenous testosterone that will shut off his own. Yes. He's still active. He still has some testosterone that he produces. It's pretty good for his age, 600, I used to have 650 when I was 26 before I started using steroids. But yet he can improve his symptoms by taking Muscular and DHEA.
Yeah. I wish I had tested. I didn't do blood work when I was in my 20s. I barely ever went to the doctor. I wish I had my test checked before I started using steroids, because I bet it was sky high. I bet it was, but we'll never know. All right, next one. Hey, doc, I'm on 250 enanthate a week, split in 2 doses, Monday and Thursday, for about 1.5 years, TRT protocol. Everything looks okay on my blood tests except FSH and LH, which are both in the 0 point something zone. I'm taking pregnyl, HCG, 600 IU split in 2 doses a week for the last year. Erections are okay, but ejaculation volume has gone low over time. What can I take to increase FSH and LH?
Nothing. TRT shuts off. This is pure physiology, even though you're HCG. Besides, if you're using a monotherapy of HCG, it shuts off gonadotropins because it's a mimicker of GnRH. It's a mimicker of LH that kicks GnRH, but in the paper it shuts off. What you should be aware of now, be interested, is the seminal diagram, meaning not just the sperm volume, but the spermatozoa, how many. So this guy is injecting 250 testosterone, slightly above the range, but how much of HCG he's implementing in the regimen?
So that
500 or
is,
1,000?
so he's doing 300 and 300, 600
No, it's
600
not
every
enough.
week.
It's not enough. For fertility, you need to go up to 1,000. Sometimes 1,500, but split into doses. So he can go 500 twice a week along with his TRT.
Would that increase his semen volume or no?
Yes, but perhaps also he needs to apply 1 milligram of anastrozole per week in 2 doses of 0.5, because the HCG will increase in testicular testosterone, will convert to estrogen finally. So he needs to control the estrogens. Besides, 250 is more than supposed to be for a week, you know. So I guess 1 milligram of anastrozole would be enough.
Yeah, it's funny. Semen volume is probably the least important thing. Obviously, erection quality is much more important for sex. But
Sure.
as guys, we still want to see that tons of semen coming.
Mind that it matters how often you ejaculate. So if you store this for 3 days, it becomes large, you know.
Sure. Yeah.
It's like a pool that gets depleted.
Yeah, but man, I hate to go back to my 20s before I was on steroids, but boy, those were the days. Whew. Anyway, I won't get too graphic. I'm currently on self-administered TRT. My new doctor wants me to discontinue exogenous testosterone for 6 weeks in order to establish a baseline or see if I need testosterone at all. I've been on self-administered TRT for 5 years. I'm nervous about going off completely, as the low testosterone would inevitably revert me back to performing poorly in all aspects of life. Should I find a new doctor, or is there a better way of getting prescribed TRT?
So it's so frustrating listening to this, because after 5 years of continuous use, you're hardly likely to be restored. Besides, he's older 5 years than he started. And I assume he started because he was already lacking. So he's not able to resurrect from ashes, okay? So the only way to stop, the only reason to stop it is if you are sky high because of the cycle. So get rid of high doses, let's say for 2 weeks, let the levels go down, then restart with a normal protocol, okay? But no way, I mean, the only thing he will accomplish is to get depressed, out of shape, low testosterone levels, feel lousy, look flabby, okay, and zero life quality. That's all.
But do you agree? I mean, I could see the doctor's point where they want to see how low his testosterone really is without giving any. So they want to see. This
in first place, Ron, in first place, not after suppressing your own production for 5 continuous years.
Yeah, true. Yeah, it's going to be rough. But I mean, there are other doctors. There's plenty of other doctors out there, at least here in the US. So you should be okay, dude. Next one is.
I had a patient, I'm sorry to interrupt you. I have a patient from the States, Greek American. He visited me last year. We were able to avoid TRT because he was 26. We managed to boost his own production at 800.
Oh, wow.
Nevertheless, within the following year, the levels dropped down to 300. And the doctors told him just wait and take a little bit of sun, use vitamin D and bullshit like that. Yeah. And he went to Texas to our common friend Andres Miller, who owns the clinic. Yeah. Yep. And he said, I'm a patient of Dr. Tim Grease. He said, oh, yeah, we know the guy. So you start running, because this is the thing. I mean, for a 27-year-old guy to be 300, you know, there's no life with that.
No, that's horrible. Very, very low. I mean, even as almost 53 years old, I would be miserable with the level of 300. I know I would, because, you know, I'm at like 1968 the last time I got tested. So find a new doctor, maybe. Yeah. If that's what the doctor is going to force you to do, I would find a new doctor if it was me. So next question. Doctor, what do you think about supplementing alpha lipoic acid? Also, are there any supplements in general you would recommend that are typically not included in multivitamin supplements?
It's great. Alpha lipoic acid, I'm using this all year round for liver detox, for insulin sensitivity. And it's a good way to use it when you're carb loading, if you don't want to inject insulin. Okay, so take 1 gram of lipoic acid with meals when you're carb loading before the show. Pre-diabetics use also alpha lipoic acid. and also people who have a liver strain. And a good dose is about 500 milligrams, with your breakfast. And what else was the question?
Any other supplements in general you would recommend, which are typically not included in a multivitamin?
Well, lycopene for our age, prostate, prevention.
Yeah.
Now, about brain health, you can take ginkgo biloba. You can take also boron for the free testosterone. You can take L-carnitine for the heart health. We say many things: NAC, glutathione, red rice yeast for the cholesterol levels, selenium for the thyroid. Plenty of stuff,
Yeah. Okay. Cool. Gotta let you guys know, Dr. T did not have any preparation because I didn't send the questions to him until about 45 minutes ago. I screwed up. So these are all off the top of his head. So good job, doctor. You're doing great. Here's a good one because I actually use this shampoo for some mild psoriasis. What are your thoughts on Ketoconazole shampoo as a local anti-androgen or DHT blocker in the scalp?
Great. It's a great option for those that want to block DHT. So initially, this shampoo is sold in the pharmacies against Danfur, but it is able to block the DHT in the scalp. So it's combined with minoxidil foam, dutasteride foam, and also finasteride peros orally. Okay. So those 4 compounds are able to block DHT that only come out of testosterone. They do not block Primo, Winstrol, Anavar, Masteron, Proviron, just DHT. Of course, the rest of the steroids, just testosterone. So you may take as much as testosterone you like, block the reduction to DHT. You can use a little bit of GH, and you may have plenty hair, actually thicker hair.
Wow. So does it work by itself, or do you always have to use it with minoxidil? No, you need to
combine. So first you wash with the shampoo, and then you apply the foam, and you take your capsule of Fina.
Gotcha. Okay. Next one is, does Dr. T believe in keeping estradiol in a certain range, 20 to 30, like Dr. Hertog and Rand McLean, or is he more inclined to think like Neil Rousier and many others who just don't look at estradiol numbers when on TRT? It seems to be a very controversial topic among doctors.
Yes, indeed. I believe in the optimization of all hormones because too much of estrogens may induce breast cancer, prostate cancer, pre-thrombotic effect, when there's sky high. And actually what matters is the ratio between testosterone and estrogens. So if you have 3-digital estradiol, it's not cool when total testosterone is about mid-range, all right? But it's more likely if you have a sky high total testosterone around 1500, which is usually over 200 milligrams to 50, let's say, and then it's more likely for the estradiol to elevate as well. So there are people complaining, of course, lack of sex drive if you tank estradiol, but also pure erections and quality of erections and duration of the erections with super high estradiol. Puffiness, touchy nipples, it's not just estradiol that leads to water retention. It's also, it's not just aldosterone that leads to water retention. It's also the puffiness that comes out, and you look more blurry, let's say. So I'm taking 1 milligram of enanthate in 2 doses or in 1 dose, but not regularly. So if I do a lab test and I don't like the ratio between total testosterone and estradiol, or perhaps I have some sensitivity in my nipples, yes, I'm using this. But by the way, McLean believes it has to be below 50. Her dog also gives sterile, in a regular base, and the estrogens, and the mildest of all is anastrozole. But also Mogetale, by the way, believes in controlling the estrogens because I told you in the beginning of the show that elevated estrogens are responsible for the proliferation of the cancerous cells in the prostatic gland. Yeah,
yikes. Yeah, because we've talked about this before, but my estradiol was like 200 last time I had it tested.
Yeah, but you're injecting 400 testosterone.
Yeah, but my testosterone was almost 2000, so it's
even more, Ron, even more undetectable.
Yeah, the ratio was fine.
Those because 1 ml of cypionate or enanthate go over 2,000.
Yeah. This is a great question. I've always wanted to see if anyone had a good answer for this. Do steroids cause extra growth in traps and shoulders? Are there more receptors in these muscles? Can you spot a steroid user by bowling ball shoulders and excessive traps? Because you ever hear the phrase natty delts? Like natural guys can't get
what I
big
believe
shoulders?
is that the classic bodybuilding looks from if you have a neck pencil, and if you have those prominent traps, means that you're a hardcore bodybuilder, you lift heavily.
Yeah.
Okay, and the roundness over here. So it's a classic bodybuilding look.
Mm.
So when we wear a suit, we don't need those pads over here.
Shoulder pads, yeah.
Yeah.
But are there more receptors for
I don't think so.
androgen
No.
receptors?
Some people believe that if you inject in the delts, you get all the juice in the upper body. This is BS.
Yeah.
I don't think so, because the receptors are everywhere.
I don't know if there's something about
It's
the
genetics,
traps.
Rob.
It is genetics, but I see so many guys at the gym who are on steroids and they're missing a lot of body parts, but they all seem to have big traps, all of them. They could have like no legs, no back thickness.
Listen,
no
traps
chest.
are a very small muscle group, okay?
Yeah.
That is also trained along with back
Mhm.
and rear delts
Shoulders.
and traps itself, elevating the scapula, okay?
Yeah.
It's like saying that my biceps I'm not taking part when I do all the rows, all the chin-ups, all right? Anyway, I don't believe in that thing. You know, it's very simplified.
Yeah. I mean, why would one muscle group have way more androgen receptors than another skeletal muscle group?
What I know that the legs, the lower torso, the lower body department needs more reps, 15 to 12, let's say, to grow.
That's because of the muscle fibers. They have more of the slow.
Yeah, and the chest was a smaller muscle group, needs less repetitions. I don't know. Perhaps the resistance is great to the legs.
Yeah. I think traps, just because traps are so easy to work, anybody can do heavy shrugs and their traps will grow.
And you know that people are injecting also synthol over here, you know?
Oh, I've seen the Brazilians do that. Don't do that, guys. Bad. All those nerves. Can you imagine hitting a nerve in your trap? Yeah. Oh, no. All right. Our final question. This came in at the last minute. Doctor, does metformin reduce testosterone production in the body, and can it cause erection problems and spermatozoa count, low spermatozoa count?
Now, what testosterone does, metformin does, I'm sorry, is lower the IGF-1 and the mTOR that is linked to growth.
Okay.
What lowers testosterone, actually free testosterone, is the keto diet and the fasting.
Okay.
It lowers the free testosterone, which is the active one. But metformin, they say it mimics the fasting conditions. So lowering mTOR, elevation of AMPK. Perhaps in the long run, metformin could hinder the gains, but obviously this to somebody who is a pro and cares a lot about the size. I'm using the metformin all year round because of GH and because of longevity. And they say they have assessed that mouses that take in metformin live longer, and diabetic tooth patients that take metformin do not develop cancer.
Oh, wow.
Yeah.
That's great.
So Connor also uses metformin and his A1C is 5%. And this is something important as you age, because pancreas loses its ability to gets fatigued and burn out to release insulin. And you know, Mogetale said recently that erectile dysfunction equals endothelial dysfunction, which is cardiovascular disease and diabetes type 2. Wow. So if you don't have a bone or a hard on, you should check out your A1C and have a calcium score, because something goes wrong with your arteries. So your dick and your heart are related, you know how they work. See,
because most doctors will just say, here's some Viagra, here's some Cialis, and send you on your way.
Yes, this may help, okay, in such case.
Yeah.
But the most wise is to lower your A1C by diet. And you need also to do cardio, to lower glycemia, eat properly, okay?
Yeah, certainly address all the health issues that you might be facing rather than just take a pill to get an erection, for sure. Well, doctor, that is all the questions. Next week, we are planning on a special guest that you have arranged.
My mentor in TRT,
Wow.
bodybuilder, 62 years old.
Wow.
Mr. Italy, and author of many books. Yeah, we're going to have him here, and we're going to ask him several things about anything, bodybuilding and longevity, you know.
Yeah.
And we're going to meet him in Las Vegas because he will go to the International Congress the week before. So it's good to see another doctor who walks the walk and talks the talk.
Yeah, you guys are unicorns. There's not many of you. There's not many of you.
Yeah.
So wow, we got another one. But I assume he's in Italy.
Yeah, in Parma, Italy. Yeah, but he travels a lot to the States. He's a friend of Samir Benut.
Okay, cool. Well, you guys are all around the Mediterranean. You're all, not that far apart. Cool. Well, doctor, thank you so much. As always, sharing your wisdom, your expertise. And guys, if you appreciate these videos, please support the channel, like the videos, share the videos, leave your questions for next week in the comments, hit the notification bell, do all that good stuff, because we're very, very fortunate to have Dr. Tuliatos here every week, answering questions that most doctors would not have a clue. They would not. So you're very much appreciated, doctor. Thank you. All right, everyone. Thanks for watching Ask Dr. T, and we'll see you next time.